Most organizations don't manage workplace trauma well, and it costs them dearly. It is easy to discount or minimize the impact of workplace trauma on our bottom line. The evidence is there if we but open our eyes. Staff and employee turnover rates are significantly impacted by traumatic events or situations. For example, a study conducted by Mental Health Research Canada found that 51%, over half of all healthcare workers, experienced workplace trauma. Further, the study found that 22% of all employees in a cross-section of a majority of fields reported being exposed to trauma at work. This means that out of every 5 people you meet or hire, one of them will likely have experienced workplace trauma or will experience it. That's a lot of people. Most trauma goes undiagnosed. When people do experience trauma, it is expected that they will simply and in short order get through it and enter back into the workplace as if nothing has changed. But everything has changed. The effects of trauma are persistent and sticky. The person may suppress the emotion in order to function. However, this is not a viable long-term strategy. A person will experience symptoms of unresolved trauma in a variety of ways. Continual physical ailments such as aches, pains, headaches, joint seizure, frequent illness, infection, or the emergence of chronic disease, decreased resilience to workplace stress and demands, irritability, hypersensitivity, and general negativity. The rise of addictions as a means to cope with pent-up and forgotten about trauma and trauma-induced emotions. The study also found that up to 25% of individuals who experienced a trauma in the workplace 10 years earlier left not only their jobs, but their occupation, and a further 17.6% of individuals never worked again. The above data suggests that close to half, 43.7% of all people, will either change their occupation or quit working entirely due to the extreme short-term and long-term effects of exposure to workplace trauma. This suggests that business leaders and organizational managers need to not only increase their awareness of the impact of workplace trauma, but need to begin to change their approaches. Trauma awareness education, better, more consistent and mandatory mental health support and access to support for employees, in-house trauma practitioners, preventative measures not only limiting the possibility of trauma, but acknowledging the reality of living with trauma, new and innovative work schedules, working with unions to improve communication with and understanding of employees and their needs, increased days off with pay and more stress leave, amending policies and procedures with the impact of trauma in mind. Most organizations will not do the work necessary to truly help their employees. They will take short-term approaches and claim they have done all they can. It is a sad commentary on the operational values of said organizations. The experience of trauma in the workplace is a real phenomenon, and it is increasing at a very rapid pace. Mental Health Research Canada found that within the last 5 years, beginning in 2020 until the end of 2025, there was an increase of 121% for employees diagnosed with post-traumatic stress disorder, more than double the number of people experiencing PTSD within a 5-year length of time. Is this simply an increase in awareness, a willingness by medical practitioners to diagnose, or is this an indicator that workplace stress and trauma is increasing? I believe it is all three, and this means it is imperative for organizations of any size in any industry to become trauma-informed and adjust to this new paradigm. In the future, I believe organizations who experience long-lasting success will care for their employees and help them heal and integrate from their workplace-related trauma. HR costs will be comparatively statistically significantly lower for these organizations. Turnover rates will be markedly lower and employee satisfaction and loyalty significantly higher. Customer satisfaction rates will rise in response to healthy employees. Word-of-mouth marketing will attract high-value employees and recurring customers. The question is, are you going to take the reality of this age of trauma seriously? If you truly do, people will notice, and your organization will benefit in every area, including your financials.